Are you wondering how thyroid affects fertility? Now I will be telling you about thyroid imbalance and how it affects the fertility. You all know that it is an important gland which is regulating the metabolism. Thyroid gland is a beautiful butterfly-shaped gland with two lobes, right lobe and left lobe, joined with the isthmus in between. The secretions of thyroid hormones T3 and T4, usually before pregnancy and also during pregnancy, is estimated with the FT3 levels and FT4 levels. These hormones regulate energy production, growth and development. They also maintain the electrolyte balance. The most important mineral calcium is also being produced by thyroid gland in the form of thyrocalcitonin. So, infertility can be understood first by interpreting hypothalamus pituitary ovarian axis. As you all know, there are receptors also sitting in the ovaries. So, hypothalamus is the main branch located which produces the TRH. Now TRH is the thyroid releasing hormone which affects the pituitary gland, which releases TSH hormone. TSH is the hormone which is known as thyroid stimulating hormone. So when it is secreted from the pituitary gland, which is located in the middle of, when we do the cross section and the center point is there where the two lines meet, is where the pituitary gland is there. From there the secretions come over to the gland and they stimulate the thyroid gland. So now the gland, when stimulated, secretes T3 and T4. These are the hormones which regulate and produce energy. T3 is the active hormone and T4 is the inactive thyroid hormone. Now T4 is again converted into T3. As you all know, the T4 on the other hand is converted to T3, which is active form. Generally in normal human beings, 0.3% T4 and 0.03% T4 are found in the circulation, and these are the free hormones which result in physiological functioning of the gland. 75% of T4 is transported as bound to thyroxine binding globulin, 20% of trans-stertin and 5% to albumin. Now to understand the HPT, that is hypothalamus pituitary thyroid axis, which is affecting fertility, I would discuss more upon the thyroid hormones, how it inhibits gonadotropin release. As you all know, thyroid hormones usually inhibits the gonadotropin inhibitory hormones. So that is how, if there is less of thyroid hormone secretion, there will be more of chances of releasing more of GnRH. But when GnRH is increased, TSH is increased, indirectly affecting the fertility. Usually you must have seen that sometimes by augmenting the fertility factors in couples, they will give PRP therapy. PRP is the platelet-rich plasma therapy. Basically, it's a newer advancement in fertility techniques, assisted reproductive techniques, where it is found that they are giving good growth hormones which are essential for a healthy egg and sometimes healthy sperm. Now this pituitary gland is responsible to release more of the growth hormones. In hypothyroidism, these hormones are deficient due to altered GnRH pulsatile secretions. So summarizing, hypothyroidism affecting fertility, mostly it is found in women with the prevalence of 2 to 4% in the reproductive age group and 8% mostly found in women than males. The effects in the reproductive organ is due to three factors. First, increase in the thyroid releasing hormones production, that is TRH production. Second, hyperprolactinemia. And third, it is due to the altered gonadotropin releasing hormone. Whenever there are over-secretions or under-secretions, meet your doctor and check the three main tests. which is FT3, FT4 anti-TPO antibodies. In cases of recurrent abortions due to hypothyroidism, we have to also check anti-phospholipid antibodies as well. So, this is how you can check everywhere, wherever the problem is, and I would also recommend to ensure better pregnancy outcome when you are getting the prenatal care for yourself. Thank you.